How did GLP-1 medications even end up in the addiction conversation in the first place?
It's a good question. So, Ozempic, which was really the first, let's answer this question. Why are we injecting a drug once a week versus just taking a pill, right?
Okay.
I mean, why wouldn't we just take a pill? The problem was with the early versions, the oral versions, is that the absorption in the intestine was really variable. So if you ate anything, you had to be fasting. You couldn't eat for at least 30 minutes afterwards. You had to take it at the same time every day. How many people can do that? Plus, if you're going to think about the idea of using it in addiction and recovery, people being on a regimented schedule of taking medications when they're really just starting to piece their life together, unless they have an assistant that's giving them the medication on time.
It's never happening.
It's not happening. And most people are super non-compliant when it comes to oral medications. So the idea with compliance, with getting people to take a medication and have it be reliable, the less frequent you have to use it, the better.
Got it.
Okay, so an injection once a week, a good start.
Okay.
And what they saw was with people using Ozempic, was they reported that they just had not only like feeling fuller, all metabolic numbers looking better, improved insulin resistance, lowering their hemoglobin A1C, improving their cholesterol panel, maybe even a secondary effect of lowering blood pressure, is that they had less craving for food. And then when you looked at obese, alcoholics, opioid addicts in particular, you saw that they reported less desire to use, less desire to drink, less desire to smoke.
Other than Narcan, okay, which actually saves your life, okay, this is the best drug I've seen for the treatment of drug addiction and alcoholism.
That's saying a lot coming from you.
Ever.
Wow.
More than Antabuse, more than Vivitrol, more than anything. This is the one. This is the one.
That's pretty awesome.
Yeah.
I mean, I don't disagree. Our patients, our clients are staying sober.
I just, and much more than they used to be.
I know you're going to be out of business.
It's okay. I'll find something else to do. We'll solve the homeless crisis next, I promise.
I mean, yeah, it's true. I mean, beyond the just like, okay, so you stop them, snake oil salesman that sold like an oil that'll do something that'll cure everything in your body.
Right.
Okay, let's talk about it. You look at, in medicine, people with stacks of medications across the board. You have 4 things really that are going to kill you besides not wearing your seatbelt and guns and accidents and not wearing a helmet when you ride a bike, which are the most common ones. One of the most common ones. But cardiovascular disease, stroke, major adverse cardiac event. It's called MACE.
And your wife.
Okay, that's number 1. That's number 1.
Number 1 killer of men.
And women is cardiovascular disease and stroke. Okay, number 2. Cancer, lung cancer being number 1, colorectal, breast and prostate cancer, moving down the list. Number 3, if really you want to look at it, Alzheimer's disease, dementia, and the complications thereof of that. And number 4, metabolic diseases, which are what? Which are diabetes, is the big one. Then we get into women. More women die of hip fracture, osteoporosis than they do of breast cancer in this country. And that's a whole other podcast to talk about why that is and the epidemic of that. And I would love to go through that. So now we have a drug that you take once a week, okay, that has been shown to go, I'm going to say it in really simple terms that people understand. It goes to your arteries, and that lining of the arteries, which is so delicate that you want to keep nice and smooth, and the effects of smoking, environmental exposures that create these little dents and cracks in it that allow cholesterol to hang on to there and form a clot, a plug that then causes a heart attack. So you have a medication out there that's going to keep them smooth, that's going to keep them from spasming, that's going to lower your blood pressure.
That's what the GLP-1s do.
On top of, it's going to lower weight so that your heart isn't pumping and working as hard. So there goes number one.
And your blood pressure isn't.
Right, and your blood pressure is going to come down. Number two, we're going to go to cancer. For women, obesity lends itself to fat cells that produce estrogen that increase your risk of potentially, maybe a promoter of breast cancer. I'm really hesitant to say that, but there's probably a role in there. Uterine cancer, absolutely. And for men, prostate cancer, gastrointestinal cancer. So now you have a drug that's going to control weight, that's going to reduce that down, that's going to increase your insulin sensitivity, which in turn is going to lower inflammation. Lower inflammation in the body is going to equal less of a chance of cancer.
For sure.
Okay. Alzheimer's disease, dementia. New data coming out, ongoing trials that say that probably you have a reduced risk of plaque formation in the brain. Plaque formation is what we find in radiographic studies showing Alzheimer's disease and dementia.
You're kidding.
No. So if you get a diagnosis of dementia, of Alzheimer's disease, and you're 60 years old, it's like getting a stage 4 cancer diagnosis. There ain't shit you can do about it. You can try to slow the progress of it, but you got that diagnosis. What you do now is what's going to prevent that from occurring. A GLP-1 potentially for, I could sit here and say probably everyone would benefit from it, even in a microdose. I think that's where we're going to land in some way, but reduces that risk of plaque formation. Then we move to the fourth one, metabolic disease. Well, diabetes it's a layup, right? Increasing insulin sensitivity, less obesity, reverts right back to number one, cardiovascular disease and stroke. So that's why diabetes is such a killer, because it not only has its own havoc on blood vessels, amputated feet, obesity, all the other things, but then it goes back to cardiovascular disease and is one of the major risk factors.
We're out of time. Please subscribe on YouTube, click the thumbs up, and leave a comment. Please subscribe on Apple Podcast and Spotify and leave a rating and a review. And share the We're Out of Time podcast with others who will get value out of it. See you next Tuesday.